Cervical cancer remains a serious disease, even though across the country we have screening programs that have been effective in reducing the frequency with which women get cancer of the cervix. There are about 1,400 cases diagnosed a year, and about over 400 of those women will die of that disease. So even though we have had great successes, we now have the opportunity to have even more success, as this is now an almost completely preventable disease with a combination of screening and with vaccination. The fact that 90% of women in the age group studied have not received the vaccine is a tremendous lost opportunity. I believe it's due to lack of information. I believe there's a certain element of confusion. And unfortunately, I also strongly believe that there is an element of cost. This is an expensive vaccine. Half the women that were interviewed found cost to be a barrier. The fact that almost 70% of women interviewed didn't know enough about the vaccine speaks to a number of issues. What it boils down to is something very simple. A common infection resulting in significant disease can now be prevented by this vaccine. So I strongly encourage them to get informed about what causes abnormal pap smears and cervical cancer. I strongly encourage them to inform themselves about the vaccine and consider how they might get the vaccine and overcome the barriers such as the delivery. It's a three-dose schedule. That's not easy for some people, and the cost. The absence of a recommendation from a family doctor is critically important because we know that the relationship between family doctors and their patients is a really reliable and a trusted one. And we also know that family doctors play a really important role in other vaccines, childhood vaccines, adolescent vaccines, etc. And so it's very important that family doctors become involved, become knowledgeable, and are able to provide information and encouragement to women and girls to get this vaccine. Just as women are protecting themselves against skin cancer by wearing sunscreen, lung cancer by stopping smoking, and all sorts of other interventions like a healthy diet, they should get this vaccine to prevent against cervical cancer. Cervical Cancer Awareness Week has become increasingly important despite the fact that we have good screening systems that reduce the frequency of cervical cancer. At the present time, however, between the effectiveness of those screening systems and the availability of a vaccine that prevents infection with the virus that we know is responsible for cervical cancer, this is now a virtually preventable disease. And awareness among the public and among healthcare providers is the only way to achieve that goal. Cervical Cancer Awareness Week is happening at a national level this year, October 24th to 29th. And there will be events, activities, and media all across the country that we hope will promote knowledge and awareness of cervical cancer and its prevention.